Now that you have learned about good practices in collecting disability data in healthcare, in this short presentation, we will focus on how to use this data in health service planning, monitoring, and evaluation. Implementing a disability-inclusive health service requires careful planning, monitoring, and evaluation. And planning, monitoring, and evaluation requires effective systems for the collection of information or data, as we learned in the previous video. Once we are collecting data on disability in our health information systems, we can use this data to understand the current situation of service utilisation by people with disability, how disability inclusive our mainstream health services are, and outcomes of activities implemented that target the specific needs of people with disability. Ideally, disability inclusion occurs within the planning of all mainstream health services and activities, but planning for specific activities to target and improve disability inclusion within health services may also be necessary. Disability inclusion must be incorporated into health service monitoring and evaluation systems to monitor the inclusivity of mainstream services and also to monitor and evaluate those strategies and activities specifically designed to increase disability inclusion. Planning for a disability-inclusive health service involves first collecting data and analysing data to understand the current situation. This data may come from a range of sources, including audits, surveys, or routine health information systems, and once analysed can provide an understanding of the current situation in relation to demand for health services by people with disability, the specific needs and unmet health needs of people with disability, service provider capacity to meet the health needs of people with disability, and barriers to health services for people with disability. Using the information from a situation analysis, it is possible to begin planning what is required to deliver a more disability-inclusive health service and identify relevant objectives and strategies to achieve this. Activities and resources, including budgets, are then decided upon and allocated in order to achieve the objectives outlined in the planning. Strategies to improve disability inclusion in healthcare should be periodically evaluated for their effectiveness and revised accordingly. Collecting and analysing disability data in monitoring and evaluation allows health services to evaluate the success and impact of disability inclusion strategies against the original objectives identified during planning. After analysing routine data, it may be useful at times to collect additional in-depth data about the experiences of people with disability utilising health services to examine a particular issue or trend more closely. There are many different tools and methods available to do this, depending on what you wish to find out, and could include surveys, interviews, or focus group discussions, for example. Undertaking monitoring and evaluation activities of disability inclusion in your health service is a key mechanism to capture learnings about disability inclusive practice, find out both what did and did not work well, and use these findings to inform future planning and implementation of activities. If our goal is to effectively plan, monitor, and evaluate disability inclusion in healthcare, then we need to establish disability-sensitive indicators by which to monitor our performance. Disability-sensitive indicators are used in combination with disability-sensitive targets and disability disaggregated data. For example, if our target is that we wish to implement a staff education program to increase awareness of disability and remove attitudinal barriers, we may use indicators as outlined on this slide to monitor and evaluate our performance, and we will collect data that enables us to report against these indicators. Our input indicator or measure of the resources needed for implementing the training could be expenditure on training materials and facilitators. Our output indicator may be the number of people who have completed the training. Our outcome indicator may be the number of people with disability accessing the health service in a given period. And our impact indicator, which we hope to ultimately achieve over the longer term, may be that people with disability have the same health status as the general population. Indicators need to be developed specific to the activity and context, and there may well be indicators provided by governments or funding bodies with which to align your choice of indicators. We hope that has given you some understanding and ideas of how you could use disability data in your health service. Now please return to the workbook and complete the activity in step 6, where you will identify a service development activity to promote disability inclusive practices and identify the disability inclusive indicators you will use to measure the success of your activity.